Hi there, good morning, good afternoon, and good evening from wherever you're watching. I'm your host, Celesta Mary _RN, and today I'm so glad to be with you. I'm so glad to provide the knowledge that I have and to share with you. And I am so happy for those of you who have liked, who have shared, and who have commented also and subscribed to my channel, Celesta Mary _RN. I really appreciate your comments, your beautiful comments. I really appreciate that people are learning from all this. Please just hit back on the comment section if you have something that you want to comment more about. I know we have got different viewers. Some are also health professionals like me. There could be something you want to add or chip in. You can always do so. Otherwise, I'm so happy to be with you. I'm so happy to be here. And today we continue with our series about vital signs. Remember, we started by learning about temperature, then we went to pain. Actually, I jumped from temperature to pain, which is the fifth. There are five vital signs that are normally taken when you're in the hospital. But I decided to jump and back to pain because pain will affect this other rest of vital signs. Today, I want you to sit back, to stay tuned as we learn about pulses. They are called pulses or heart rate. What are these? How does a pulse communicate to a doctor about your health? Do you know your pulse rate? What does it mean? So I want you to stay tuned as we continue to learn about vital signs because they're important, because your health is your priority, and your health matters because your health is your wealth, and you need to take good care of it. Hi there, welcome back. So we are learning about pulses. You may have gone to a hospital and you're told your pulse rate is very high, or you're told your pulse rate is very low, and you're wondering what does it mean? Why can't they just take me to the theater and leave me alone? Why can't they just let the doctor see me? You have a toothache, and you're wondering why are they taking my pulse? How important it is. I am your educator, and that is the reason why I'm here to educate you why your pulse is important. So you're going to learn about pulses. What is a pulse? Another English word, we call it heartbeat. It tells us of how fast rate or how slow your heart is beating. Actually, we have peripheral pulses, that is pulses on extremities. Your fingers, your legs, your arms, and your legs, those are peripheral. They are far away from the heart. Central, the left side. Your heart is on the left side of your heart. Your heart is on the left side of your arm, of your chest, rather. So where your heart is this is central. Then as you move farther away to the other parts, now it is called peripheral. They are on the periphery. So we have two: central, which is an apex beat, and you can only listen to it using the stethoscope. That is why you see us having a stethoscope on our necks, because you can easily pick an apex beat, that is a central beat, and also you can pick peripheral beats on the feet, on the hands. If you have got a burn, your hands are all burnt up, your upper body is burnt up, only your legs are remaining. We can still check your pulse. Through what? Through your legs, peripheral pulses. So two, central and peripheral. So the common one that we normally use is the peripheral pulses. What happens when you get in? And I'm going to be teaching you how to take a pulse, even when you're at home. What does a pulse tell us about you? So let's keep the training going. So number one, let's start. Pulses are normally taken either in the hospital setup, it could be in a medical camp, it could be at home. Somebody was just talking to you, and all of a sudden, the chest is not rising, they're not responding. You'd want to check the pulse. But did you know that peripheral pulses, the ones on the extremities, the legs and the arms, sometimes they get lost. You might try and get them, but you're unable to get. Why? Because once the central part, which is the heart, is affected due to some whatever reason, either you have a non-cardiac condition, So it is beating slowly. You'll find also it is not easy for you to get the pulses on the peripheral side. So you have to check the carotid pulses, the ones that are rear at carotid artery, the ones that are nearer to the heart. So we have the carotid, at least also the brachial for the children. So where do we take pulses for different age groups? Remember, pulses are affected. The heart rate of any human being can be affected by so many things. Let me start by saying the age. The older you are, the lower your pulse rate is. That has been proven. Why? Because as old as you get, your organs also become what? Old. They're not as active as when you're young. And children who are born immediately, their heart beats faster, very, very fast. So age can be a factor. So with these two extremities, very old, very young, very fast for the young, and very low and very slow for the old, you need to know that. So that if you get your grandmother, 73-year-old, and the pulse rate is at 60 or at 50, and you start getting worried, oh, so what is happening? That could be the default heart rate for that person. But you find a child whose heart rate is 50, that is not a default. We expect that small children, their heart rate should be between 60 and 100. If their heart rate is below that or is above that, then there could be a problem. So a heart rate is a good indicator, an indicator to tell us what is happening with your heart. How fast or how slow is your heart beating? And you need to be cognizant of the same. So healthcare professionals, we are normally taught. So at the back of our mind, we know. That is why when you go to the hospital, you ask about your age. You wonder, the doctor asks you about your age. The nurse is asking you about your age. The physiotherapist is asking you about your age. Everybody is asking you, and you're wondering, why my age? Because age has a factor. It affects so many things. Your age can easily help us to put you in a certain bracket and not in another bracket. So heart rate is very important. So I said, you come to the hospital and they want to take your heart rate. How do you take the heart rate of a patient? I told you we have central, where you can use the stethoscope, put it on your ears, especially the central or the apex beat, we take it for children or neonates. And once we put it on our ear, we put it on the apex beat. So there's a way you locate the heart and you check using the stethoscope, because there you want to hear it well. This machine is called a stethoscope, and it helps you to hear the beat very clearly. What about for the normal other human beings, adult patients? You normally check using the radial pulse. This is called the radial pulse here. Now, you need to use 3 fingers, not 2, not 1, not the thumb, 3 fingers, like you find the people who are not in red, is it Red Cross or Scouts? 3 fingers. And you place it on this place. And you put firm pressure, just a little bit firmly, and you will for sure feel there is a beat. So you need to check your watch and start counting. You count for 30 seconds. Count as you're checking the watch. That's why nurses, we do have our nurses watch. So nurses watch is not on your arm, it's on your pocket. So it's easy for you to check the pulse of the patient as you're what? Observing. You're counting 1, 2. As you just, if it's regular, if it goes on every time it is going at the same beat, know that is regular. There's nowhere where it is stopping. After 30 seconds, just multiply by 2. But if you start taking a pulse, the first time you're taking it, you can hear it. Then sometimes it is not coming. Then again, it is disappearing. You need to take for 1 full minute. I want to repeat that again. We take pulses on the peripheral side using 3 fingers. Put it here and you will feel a pulse. Using your watch, check the beats. Listen to the beats because the pulses are there. You listen. If it's regular, it comes on at a very regular interval. You can hear it every other time. Check for 30 seconds, multiply by 2. But if you put your hand, you hear the beat. The next time you're not hearing, then you hear it happening twice, and then it disappears. You need to check for 1 full minute. All pulses should be checked within 1 minute. Regular cases, you just need to check for 30 seconds, and you'll have a rhythm already. A rhythm telling you this is okay. Pulses. You put your finger, you realize this one is regular, it is happening every other time. You know that is the rate. 30, after 30 seconds, multiply by 2, you get your value. What about when it is irregular? Stay for 1 minute, check it, just listen until it is there for 1 minute, then record how many times was the heart, was there that beat using your fingers. We do not use the thumb because the thumb has its own pulse. So if you right now I'm educating you, you go to a health facility and you see somebody using their thumb to check your pulse, that is their own pulse. You tell them, excuse me, I thought you're supposed to check with your fingers. I hope that is very clear. Now, when you are checking, what is the normal pulse rate for each and every age group? As I said, for small children, the normal pulse rate is between 60 to 100. Neonates, the ones who are newly born, it goes up to between 100 to 160. So if it is below 100, then you're worried, what's happening here? But for you and me who are adults, 60 to 100 is okay. For athletes, people who are athletic, you have the Kipchoge Keino, we have our female runner. When you check their pulse, it might be 40, 45. You should not be rushing and calling in for a doctor to come and intervene because their heart is so much used to pumping once and circulating to the rest of the body, pumps again, and blood circulates to the rest of the body. Their heartbeat is a bit lower because they are athletes. That is why you in the hospital will be asked, what is your career? What do you do for a living? So don't get mad. Why they keep on? Why do they want to know my affairs? No, nobody is interested in knowing whether you are running or is interested to know whether you are farming or you're working or whatever. All we want to know, we want to use that to help us, to give us information to find out how well you are doing. Your pulse rate. Very important indicator, but if not done well, can be a problem and can give us wrong information. I want you to stay tuned as we continue to listen and to learn about pulse rate. Very, very important. So I want you to subscribe, to like, and to share as we continue to listen and to learn about minutes is normal heart rate. For athletes, 50 to 60 beats per minute is normal. For children that are aged 1 year to 10 years, about 60 to 140 is normal. And for children who are now teenagers, preteens, 11 years to 17, 60 to 100 is still normal. So what happens when your heart rate is not normal? It's not within that range. Somebody like me, I am an adult. Let's say my heart rate is not between 60 and 100. It is 40. I am not an athlete. I don't run for anybody. I don't do any exercises. I am just dormant in the house. The kind of work I'm doing is office work. I hardly move. I have a car after leaving the place. So you have a domicile lifestyle, but your heart rate is below 60. Then there we query there could be a problem. But if your heart rate is between 60 and 100, and then when your heart rate is also more than 100, what could be the problem? So we're going to learn about what are some of these things that can make your heart rate be very fast, your heart beats very fast. What are some of these things that can make your heart beat so slowly? So as I said, number one is age. The older you are, the more your heart rate becomes slower. Your heart can no longer do the things you used to do before. You find the old people when they climb the stairs, they're feeling tired. The heart muscle, because of age, because everything in our body starts going on a downhill as we age. That is why you find your eyes have issues. Some of us, your skin that had good tagger, it now starts losing the tagger. Everything is now going on a downhill. So even your heart rate, your heart is no longer beating and as energetic as it used to be. That is one of the factors that could happen. Now, just want us to go and talk about this issue of the pulse. I just want us to go back to that before we venture more into this other one. Now, there's this thing whereby the heart rate is not regular. It is not beating regularly. Like if it's starting beating one, ta, ta, ta. It is ta 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 ta. It's like it's not regular. It is either missing the beat. Sometimes it goes faster. Sometimes it misses. Sometimes you wait for a very long time before you can feel the pulse. Irregularity. So whenever you're checking for the pulse, there are three things you're looking at. You're looking at how fast is it beating, the rate. That is why you need what? A clock or a timer, and then your three fingers and check. The other thing is check how strong is it. Yes, you could be having a pulse rate of 60 to 100 as an adult like me, but how strong? Maybe it is very faint. Somebody cannot feel it, but there are some people it is pounding. You can literally feel it with your hand. It is so pounding. So that is the second indicator we look at. Yes, it is within normal range. Is it strong or is it weak? Because a weak, thready pulse also can tell us something is happening within your heart. Or a strong pounding also can be an indicator that something is going on within your heart. So we have talked about the strength, the rate, and the quality. All that are very, very important, even as we continue to learn about heart rate. So we talked about age, and I've given you the age brackets in which people have got the expected rate for different people. What are some of the other things that can cause people to have changes in these ranges of heart rate? Number two thing, apart from age, is emotion. What is your emotion? Are you angry? That people, when they are angry, they're literally shaking. The heart starts pounding. And you look at them sweating because the heart is pounding faster. The anger in them makes the heart release adrenaline or releases hormones that help the heart to quicken faster and it beats faster. So what is the kind of emotion that are you experiencing? Are you sad? Are you angry? Or are you anxious? That is why you find people, they're going for an operation, they have come to the ward or the department, and all of a sudden you want to start giving them the IV. The heart starts pounding so fast and you're wondering what's happened. Your pulse was very okay. Now it has changed. So the emotional aspect of it. And I said a third thing is activity or exercise. Somebody who has been exercising for long, as I told you, athletes, their heart just pumps once, and it goes, blood goes to the rest of the body because the heart is a pump of blood and nutrients to the rest of the body. Then it pumps again. Because they've been exercising so much, once the heart pumps, it pumps strongly and it does its work well. Their heart is so healthy. Exercise also makes your heart be healthy. And when the healthier it is, the more it is not, it doesn't have to work so much. You just pump the correct way and distribute the nutrients and the blood that you so require to the rest of the parts of your body. Another fourth thing is your posture. You come to the hospital and the nurse checks your pulse. When you're lying down, your pulse is different from when you're standing up. When you're lying down, your body is at a state of rest. You'll find your pulse tends to be a bit lower. But when you stand up, because your body is at a state of upright state, your pulse now becomes harder or it becomes quicker, slightly increases. And you can do that while standing and while seated or while sleeping. Your heart rate can change. So all factors should be considered. When you're taking a pulse of a patient, just check, am I taking it while they're standing? So if it's slightly high, you just say, okay, this is just slight because they're standing. Or did they just come into the department and you started taking their pulse? Maybe they are rushing. You find that in the time of Mandamano, somebody has been rushing away from a tear gas. And as they approach you, you want to check their pulse. It will be so high. You might be tempted to intervene in things that are not supposed to be. You just need them to sit down, calm down. And that is why you find most of the nurses, when a patient comes, before they take all the vital signs, they start asking you questions. How are you doing? What brings you to the hospital? How are you feeling today? So as you are being asked, you tend to calm down. And now when they take the pulse, at least for some minutes, your body and your heart has calmed down. So your pulse rate becomes normal or near normal. So it is easy for them to get the correct pulse rate at that time. Because as I tell you, other things could be also a factor. So the other thing that also affects the heart rate is fever. I told you the first vital sign we were checking was temperature. If you have a high fever, your pulse rate will go up. So if a patient comes with a temperature of 39 and their pulse rate is, with an adult, is above 120, you want to take care of the fever first before you take care of the heart rate. Fever can increase the heart rate. Cold or hypothermia, when the fever is very low, also can reduce the heart rate slightly. What about the blood pressure? Always, when the blood pressure is high, there is also an increase of blood flow. So the heart rate will also, is bound to go high. What about when there's a disease condition? Somebody has a non-cardiac case, they have a pacemaker. All those things can make the heart rate go low or can make it very high. Some people use drugs that make what? That help stimulate the heart. So those things can make the heart rate to go high. So that's why you always ask, are you on any medication? So never feel offended. Why am I being asked this question all over again? And I said we learned about pain in the last episode. Pain is also a factor that can increase the heart rate. And in the hospital setup, patients who are in ICU cannot talk, but they're in pain. You're seeing the BP and the heart rate is rising. The respiration, the chest is rising and falling very fast. Could be there is pain also, apart from other factors. Because they cannot talk, you cannot rate the pain, but you can use the vital sign, heart rate, to tell you whether this patient is going through pain or not. Hemorrhage. Somebody has been involved in an accident. When you bleed a lot, your blood pressure also goes very, 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 very high. The pulse rate, sorry. You're bleeding, you're losing blood. So the heart that is supposed to be pumping blood to the rest of the body realizes that as I am pumping, it is being lost. So it pumps very fast. And the more it is pumping, the more you're losing blood. So people who have gone through trauma, you find their pulse rate, the body is trying to compensate. The heart is saying, we are losing a lot. Can you try to generate more? So the more they're trying to generate more, the more the heart is pumping and the pulse rate goes higher and higher and higher. We've talked about severe or chronic pain. The people who have got chronic pain always, you find their pulse also goes down. We have people who have got position, and I told you about position. If you're lying down, posture, or you're standing up, also that gets affected. Heart rate. What affects your heart rate? It's very important for us to know that these are some of the factors that affect our heart rate, and it can make it to be very high or very low. But nevertheless, when all these factors have been considered and still your heart rate is low and still your heart rate is high, then there has to be an intervention. I want you to stay tuned as we continue to learn about this vital sign that looks so simple but can tell us so much about your disease process or your body as a human being. because your health is your priority. Your health is your wealth, and you need to know how your heart is functioning. Stay tuned, subscribe, like, share. So, ladies and gentlemen, you who have been watching me, we have been learning about heart rate, a very important indicator that can tell us what is happening in your body. And we have learned that heart rate can be high or it can be low. We have also learned that the heart rate can be affected by different things. We've talked about the age that an adult's normal heart rate is 60 to 100. But you'll find an adult who has got whose heart rate is 60 to 100, but you find an older person whose heart rate is cannot range, because the older you are, sometimes the less the values are, unless there's a disease process that is going on in your body. We've also learned that children also, or newborns, their heart rate is very high because they are small, their surface area to body ratio, the heart requires more, they need to pump blood to the rest of the body, so their heart rate is faster than this person who is much older, whose system is slowing down. We've also learned that there are places that you can check the heart rate. Of an adult, we use radial pulse here, and we said we use what? 3 fingers, not 2, not 1, not the thumb, but we use the 3 fingers. You press firmly on this side. For children, for easy accessibility, you can use, I don't know if you can see the elbow here. This is called the brachial pulse. For infants, it is easy for you to check for a child. Here, the pulse, it is easy for you to locate because most of the time, the pulses, some are chubby or you cannot easily get. So the further you are away, the harder it is. And for even small children, the infants, you find us using the stethoscope to check the apex, but to really know, because the heart is on the left side of your chest. When all the other pulses have collapsed, there is one pulse that we use when you, especially you find a patient is lying down, not responding, you're trying to call them, hey, are you okay? They're not responding. There is a pulse called the carotid pulse. And this one we check here on the trachea. Then you move 2 fingers below. It is much nearer to the heart. So it is very easy to get it. It is thicker than these other veins. These arteries are smaller, but here it is. The carotid artery is larger. Here, these arteries are very tiny, so you can easily miss out, especially when you're in shock. So the nearer the heart, the better. So carotid is nearer to the heart, so you can easily not miss it. Pulses. It is very important because the pulse tells us the condition of your heart. Tell us how well your heart is pumping. And I also say that you shouldn't get worried if you're an athlete. If your heart is pumping at 40 or 50 to 60 beats per minute, then you shouldn't be worried. Because athletes, because their heart is so used to, is very healthy, and because they are athletes, they have been running around, their heart pumps once and goes to the rest of the body, then the heart is much healthy and the pulse rate is much lower. Doesn't mean they're sick just because they're athletes, they run and the heart is very healthy. It has gotten used to that environment because of their athletes. What happens when there is no heart rate? When there's no heart rate, even the machine will show a straight line. Means there's no cardiac activity. There's no heart activity in your body. And at that area, we normally start to do chest compressions. We start pumping your heart manually with our hands. And you can see that in resuscitation, whereby we see this patient does not have a heart rate. We have checked all the central pulses, we've used the stethoscope, no heart rate. We start pumping the heart by our own hands. And we make sure you compress the heart, and there's a technique used. That one you cannot demonstrate here. That one you have to be taught as a healthcare worker. You have to know in a healthcare system So if you get a patient in a healthcare, in a non-healthcare area, they were looking at you, responsive, but all of a sudden they're no longer responding, then you need to rush them to the nearest hospital so that they can be taken care of. You cannot take care of an unresponsive patient who has no pulse, radio pulse, has no carotid pulse, and you are there with them in the house. You need to rush them, get an ambulance. And I always say to be safe, have at least one number of an ambulance in your neighborhood. Know a neighbor who is a nurse, know a neighbor who is a doctor. They can easily assist you. Get an ambulance, go to the hospital and get checked. Because anything that is below normal or above normal is a risk. Thank you very much, all of you, for listening to me. I was your host, Celesta Mary _Aren, and you have been learning about pulses because pulses are important. Always give the nurse and the doctor the best correct information so that they can assist you and they can intervene appropriately when the help is required. Keep on watching, share my channel, like. I want you to comment and let me get your comments whether you're really enjoying what else we should teach. But we are on a series of teaching about vital signs because they are as vital as they are. Thank you all, and I want to say have a good night, good morning, and good afternoon from wherever you're watching. And thank you for the support that you're giving me. God bless you and have a good night. Ciao.